in the spotlight this morning, Dr. Grainger Lanneaw. I'm just getting to know Dr. Lanneaw right now. He's the chief of gynecology oncology at Vidant Health, and we're just talking about the fact that he came here because he wanted to get involved in teaching as well. So I'm assuming he has some role at Brody. Good morning, sir. How are you?
Fine. How about yourself?
Nice to have you here. We appreciate you coming in.
Yes, thank you.
So your title at Vidant is Chief of Gynecology Oncology.
Correct.
And this is Cervical Cancer Awareness Month, which we're going to talk about in a second. But talk about your role, because you're also teaching at the School of Medicine.
Correct, yeah. So chief just means that I report to me, and then I report to the cancer director, which I like to do. So I really have an adult job. And then the other thing is that we have young learners, residents from ECU, and so they need instruction in gynecology, oncology, and so I provide that through lectures and through teaching and surgery, that kind of thing.
We have a big program for that at Brody here?
Yes, we do.
We do? Mm-hmm. Yeah, good. To begin with, tell us what cervical cancer is. My wife, by the way, has been working in OB forever. She just retired, but she was involved in OB at the ECU Women's Clinic for many, many years.
Sure. And, busy, no doubt about that. Well, I mean, really, the question is, what is cancer? And so cancer is really cells that go unchecked. They don't behave through natural borders. And just like the foundation of a house, cells are built on a foundation. And what actually determines cancer is those abnormal cells breaching that foundation. And that doesn't matter whether it's in the breast or the cervix or the uterus. And the cervix, as you know, is the end of a pear-shaped organ, which is the uterus. And it's responsible for dilation during childbirth. And cervical cancer affects that area in particular.
How does it present? What are the symptoms of cervical cancer?
Well, sometimes nothing, and in fact, in the early stages, very few signs at all.
Yeah.
But as the cancer progresses, sometimes pelvic pain. But the most common symptom would be abnormal bleeding, and that bleeding oftentimes occurs after intimacy. And so women will come in and they'll say, "I have had intimacy with my husband, and we start having bleeding afterwards. That's not normal for me."
Yeah. So, but you said sometimes there aren't any symptoms. How do you detect it? Just through normal exams?
Right. So, actually, you know, we're very lucky in that we have the Pap smear and the Pap smear and HPV tests, and those are very accurate. The problem is you need to get those tests in order to detect the cancer. And like any good screening test, you need a test that is simple and effective and accurate and can predict before you have the cancer. And that's what the Pap smear does. So the Pap smear is really our friend, and it's something that we really have to get the community really involved in to get.
And we'll come back to that, because that's one of those preventative things that
Sure.
that all women can do, that not all do. They should. It's kind of like the prostate stuff with men and that kind of stuff.
Exactly.
So what are the risks with cervical cancer? When you hear the word cancer, you have to assume it's a very serious problem. But what are the risks with cervical?
Right. You know, with some cancers, there are genetic predispositions. Other cancers have environmental factors. And with cervical cancer, probably the most important risk factor is the persistence of a virus that's called the human papillomavirus. The human papillomavirus has about 200 different subtypes, but there is probably about 2 or 3 that are very important for cervical cancer that we detect with the Pap smear.
And is it a particular age that people are more at risk? Like with men with prostate cancer, they say, you need to start getting tested for that and getting those PSA tests at least in your late 40s or early 50s. I mean, how about cervical cancer with women?
Right. I mean, isn't it everything, middle age, right? And so women 40 and up are the ones that are really overrepresented in the cervical cancer realm.
How do we do in this region of the state with cervical cancer? Is it more prevalent here, less prevalent?
Actually, unfortunately, the Southeast is overrepresented as compared to the rest of the country. But I would tell you that between Georgia, South Carolina, and North Carolina, we have a prevalence very similar, about 7.1 per 100,000. And so if you look at this region, eastern North Carolina, we're looking at about 1.4 million people and about 500,000 women, and a couple of 100,000 of those are the ones that are really at risk. Unfortunately, when you do the math doesn't add up, because we have anywhere between 350 and 400 cervix cancers a year. Okay, so that's more than what we should be having.
Dr. Grainger Lanneaw, who is the chief of gynecology oncology at Vidant Health, We're talking about the fact that it's Cervical Cancer Awareness Month. Now, what does Vidant do to help screen people, and at what age?
Right.
And again, we talked about a lot of people who don't get Pap smears as much as they should and as often as they should. What does Vidant offer, and how often, and who should come?
Sure. Well, in general, particularly this month, since we've launching the cervical cancer awareness, we're doing more than what we normally do. But national guidelines say women should start at the age of 21 and have a Pap smear every 3 years on up to about the age of 30, and then every 5 years thereafter. Those are the national recommendations, and so everybody in the community knows those. It's just getting the community in there to do that.
So does that mean the risk goes down the older you get?
No, that means that as you get older, we start also testing for the virus itself.
I see.
And if you don't have the virus, remember I said persistence of the virus is what we're looking for. But if you don't have the virus, yes, your risk definitely goes down, and we can expand or reduce the amount of testing.
So what is Vidant, if people need to get screened, what is available from Vidant Health?
Yeah, so in February we have a program for folks that don't have health insurance. And actually, when you'd asked me about risk, the risk is basically inversely related to income. It's also inversely related to the amount of prosperity that a county sees. And so Eastern North Carolina, unfortunately, we're kind of overrepresented. So we're targeting a group of folks anywhere between 21 and 64, and they can come to Vidant, and they can register at the Eddie and Joe Allison Smith Tower. They can call a number 252-847-7943. And they can get a free Pap smear screening, and we're happy to see them.
No cost, no insurance.
That's correct.
Just call and set it up.
That's right. For the underinsured folks, these are the people we're targeting.
All right. Again, that number is 252-847-7943. Another example of the great things that have come about as a result of Vidant Health and the Eddie and Joe Allison Smith Cancer Center here. It's we're increasing the services and hopefully decreasing cancer.
Yeah, certainly we've made an impact, and it's a lot less. Unfortunately, this is one of the cancers that we should actually not see any at all. You know, so what we're looking at Vidant is life without cancer.
Right.
And the Pap smear is certainly one of the cancers that we can really help them with.
So if you do detect it really early, it's treatable.
That's correct. That's correct. Just like anything, if it's in about here in North Carolina, about 40% is detected early, and early detection sometimes only means that you can have a minor surgery to cure the cancer. Sometimes you have to have a hysterectomy, but yes, you can definitely treat it early. As it goes more progressed, the chance of survival decreases, and the treatments are starting to be reduced.
All right, that's great information. And again, for anyone who does not have insurance or is underinsured and needs to be screened, the number again for Vidant to set that up at the Cancer Center is 252-847-7943. I'll tell you, as Vidant has continued to grow and that Cancer Center has come to Greenville the last few years, we've had a Cancer Center, but now that we've got the Smith Center over there, the Eddie and Joe Allison Smith Cancer Center, it's really, really nice to know that Eastern North Carolina has something that we did not have before.
That's correct.
I know you're new to Eastern North Carolina, but I grew up here, and I remember people having to drive 4 hours to get cancer treatment, 4 and 5 hours. If they lived out near the coast where I grew up, you had to go to either Chapel Hill or Duke. And now we have services here that no one would have ever have expected that we would have right here in Eastern North Carolina.
That's correct. I think that one of the things I'd like for people to understand is that they don't need to go beyond Vidant. The other thing is that we can offer the same thing that a number of the outstanding universities in North Carolina offer. We have experts in the field. We have outstanding studies that are ongoing, and so they can be a part of a number of things at Vidant Cancer Center.
It's nice to meet you, sir.
Yes, sir.
Thank you for being here, and
You're welcome.
And thanks for all you're doing, particularly this month with Cervical Cancer Awareness Month. Good stuff for Eastern North Carolina. Appreciate you coming in, and nice to meet you.
Yep. Thanks for the opportunity.
Yeah, absolutely. Dr. Grainger Lanneaw, Chief of Gynecology and Oncology at Vidant Health.